caller. I have my second interview, and Mary, thank you so much for waiting for us to call. We got so in the middle of talking with our callers, but I wanted to just introduce Mary Chesney. Dr. Chesney is the 38th president of my subspecialty national organization called NAPNAP, the National Association of Pediatric Nurse Practitioners. And Mary, thanks for checking in with me.
Well, thank you, Pat. I'm delighted to be with you on the show today.
We haven't spoken in a while, so I just wanted, and what we're talking about here is GI oncology, and I'm not sure if you remember my history, but for 10 years I did pediatric oncology, and a big chunk of that as a nurse practitioner, and wanted to just check in with you in terms of what's happening that we should be knowing about in the pediatric nurse practitioner world.
Sure, Pat. As our organization is thrilled because I know people complain a lot these days of feeling as though it's difficult to get anything done in Congress, but really, really important work on behalf of children was accomplished by Congress this spring, and we're delighted that in March 26th, the House came together in an overwhelming bipartisan vote to approve the reauthorization funding for our Children's Health Insurance Plan, which has been such an important program for children to make sure that children who fall through the cracks, they perhaps do not quite qualify for Medicaid, but their families cannot afford to buy private insurance for them, that they will be covered. And that program was at risk. It was due to have funds run out this September if it had not been reauthorized. So Congress did work together to reauthorize it for another 2 years. The Senate approved the same act for Medicare access and CHIP reauthorization on April 14th. So
wonderful.
We are very, very pleased about that. Along with that, they also fixed the sustainable growth rate and permanently replaced it with a much better, more updated Medicare and payment structure, and so the CHIP reauthorization was part of that as well.
That's great.
So I know that our organization, as well as American Academy of Peds and other groups who care a lot about children's health, we're delighted with that. Another just federal issue that we are currently really focused on is the ACE Kids Act. It stands for Advancing Care for Exceptional Kids Act, which was introduced in this Congress, and it's Senate File 298 and House Record 546, and this is an important piece of legislation, very much supported by all of us who care for children and by the Children's Hospital Association, because it would allow groups to form networks that would serve comprehensive networks for children's care that would serve across state lines and would really help families who right now struggle when their child needs to see a specialist in one state and they've got concerns in their care also. They reside in a different state, that it's very difficult for families, particularly those children covered by Medicaid, to be able to be in that kind of network. And so this is an important piece of legislation that we're very happy about. It's really going to, I think, help to serve children who have complex medical needs, or perhaps have some type of childhood cancer or some other catastrophic illness, and really require the work of a lot of people across state lines.
No, that's important. I know that's important with my patients. And then the other big thing that's happening for us this year is our 50th anniversary of the nurse practitioner movement, beginning with the pediatric nurse practitioners. So we're very proud of that. And so, Mary, thank you for updating us, and really appreciate it. And thanks so much for all of your hard work. And again, for the 200,000 nurse practitioners, it's just amazing, of all the work that's been done, and a lot from what you have done through NAPNAP. So thank you very much.